Many hospitals are seeing an uptick in COVID cases. This has been the concern, right? Including UCI Medical Center. Mario Ramirez is live there with how doctors and nurses are dealing with this surge. What's the reality for them?
Yeah, good morning, Michaela. We talk a lot about the numbers, but when we hear from some of the people that work in these hospitals, it paints a picture of what these frontline healthcare workers are actually going through. So this morning, we're hearing from an ER nurse with over 3 decades of experience, and these are some of the challenges she says nurses are facing here during the surge.
The nurses at UC Irvine Medical Center are most concerned about proper staffing, safe staffing, so that we could provide the best care, the care that we've been trained for. We're also happy to report we do have enough PPE, personal protective equipment, including N95s, gowns, gloves.
And she says while nurses have a lot more access to PPE, they are expecting a strain on staffing resources through the holidays, with hospitals across Southern California seeing a surge. And here in Orange County, the number of residents jumping from 380 Sunday to 428 hospitalizations on Monday. And we also spoke to an infectious disease specialist with Dignity Hospitals who says while infections are rising sharply again, they are generally less severe compared to the start of the pandemic.
To the number of positive cases, the percentage of very sick individuals are fewer than in March and April, but the numbers are still staggering, and we do not want to get overwhelmed and have no ICU beds available for patient care.
The county still has hundreds, 25% of its ICU beds available, 66% of ventilators are freed up right now. As for the concerns expressed by the nurses here, I reached out to UCI for a response, and they say the health of hospital workers is a top priority. They've worked on PPE issues and free immediate testing, and will continue to address staffing issues. But we oftentimes forget, Michaela, like many of the businesses here in Southern California, hospitals are also financially strapped.
Sure.
And that all ties in these unprecedented budget cuts to some of the issues these nurses are talking about.
Yeah, and I'm sure the nurses are like, this is the worst time to be having those cuts implemented when we're about to see this surge hit our hospitals. Okay, keep us posted, Mario, on what you learn there in Orange County.